Hi, my name's Nicola. I'm one of the directors at Mediterm Training. The purpose of this video is to help you work through an exam paper in unison with myself. We'll go through the format of the exam paper, how many questions there are, the allocation of marking for each question, and we'll work through the paper together. What you need to do is click on the attachment that says June 2014 paper, print it off, and we'll work through it together. So hopefully now you will have printed off your exam paper. I have mine here. I'm going to be looking down and referring to it throughout the course of the video, so excuse me for having to look away from the screen. As you can see, the exam is for an hour and 45 minutes. People find that that's an adequate amount of time. Some people leave early. We always say though to check and double check your answers, particularly if you've rushed at the start or if nerves got the better of you, because you may have made some silly mistakes. So it's best to use the full amount of time if you need it. You'll also see that there's 140 questions on this paper, and the allocation of marking will go through with each specific question. So if you open up your paper, you'll see question 1 starts with the title Diagnosis. You need to read this passage and then answer the questions that appear below. So pause the video, have a go at doing it yourself, and we'll come back and we'll talk about the answers. Good luck. So I hope you found that okay. Let's go through the answers now. As you'll have found all the way through the course, it's very difficult for us as mentors and providers of the course to give very exact, specific answers, particularly in the wordy answers. So as long as you've got the main gist, you can allow yourself the marks. You'll see from all these questions there's 2 marks per question. Generally that involves giving at least 2 bits of information. So you'll see below as we go through what I mean by that. So if we start with question 1, diagnosis. So this is deciding what's wrong with a patient based on their signs and symptoms. So anything mentioning signs and symptoms will get you the 2 marks there. Hypertrophic is relating to above normal development of skin, bone or tissue. Cardiomyopathy, so this is a really nice word to be able to break down. So disease, because it's got the pathy bit at the end, of the heart muscle. Cardiomyopathy, so the myo bit is the muscle, cardio is heart. Disease of the heart muscle will get you full marks there. Genetic. Now remember with this, because the word ends in ic, you need to start your answer with relating to, pertaining to, concerning. So here it would be relating to the genes or heredity. ECG is electrocardiogram. Ventricular, another word ending in AR, so you have to say relating to the ventricles of the heart. Now just be careful here, because ventricles appears in the question as well, ventricular, so it's always best to expand your answers where what you've given has also appeared in the question. So a full answer here would be relating to the ventricles of the heart, in brackets the lower chambers of the heart, just to show examiners that you know what ventricles are. Dilatation, widening or stretching of. Pulmonary, relating to, because it ends in -ary, relating to the lungs. Artery is a blood vessel containing oxygenated blood. You'd probably just get a mark for having blood vessel. Paroxysmal, relating to a sudden attack. Remember it's ended in AL there, as with atrial here, relating to the atrium, in brackets the upper chamber of the heart. So always remember to define words. Fibrillation, fluttering or abnormal rhythm of the heart. Ambulatory, relating to walking, monitoring a patient while they're walking around, something along those lines. Beta blocker is a drug to control the heart rhythm and high blood pressure. And diastolic is relating to, again, relating to the resting phase of the heartbeat. So you'll see just in this question we've got 1, 2, 3, 4, 5, 6, 7 words that all had an ic, an, ar, al at the end. So just putting relating to for any of those would have given you 7 marks. So add up how you've done, put the score down, and then we'll move on to question 2. So question 2, another question where all marks are worth 2 points, so a lot up for grabs. You have to identify the medical term, write your answer down, remember to write in block capitals as well, and we'll see how we go. So pause the video and we'll go through your answers. Okay, so number 1, a tumour of the cartilage, chondroma, spelling C-H-O-N-D-R-O-M-A. Next one is a pregnant woman who has had many pregnancies. That's multigravida. The kneecap is the patella. I love this one, it seems to come up a lot. Note the spelling is P-A-T-E-L-L-A. Low levels of haemoglobin in the blood is anemia, A-N-A-E-M-I-A. Inflammation of the membrane covering the brain and the spinal cord is meningitis. So just by putting itis there, if you didn't know anything else, you'd have got half a mark, well, a full mark, because each question here is worth 2 points. Weakness of one side of the body is hemiparesis, not hemiplegia. Hemiplegia would be a paralysis down one side of the body. Hemiparesis relates to a weakness down one side of the body. Vomiting blood from the stomach is hematemesis. I'll spell that one. H-A-E-M-A-T-E-M-E-S-I-S. A fungal condition is mycosis. M-Y-C-O-S-I-S. Absence of menstruation is amenorrhea. A-M-E-N-O-R-R-H-O-E-A. And finally, excessive production of urine is polyuria or diuresis. Both terms mean the same thing. So add your answers up there and give yourself a mark out of 20 for this section. Okay, so question 3, 30 points up for grabs on this one, 2 points again for each correct answer. If you, again, aren't sure of an answer, just put part of the word down to make sure that you get yourself at least 1 mark. This is kind of the opposite to question 2, so here you're given the medical word and you have to give the definition. So have a go, press pause on the video and we'll come back and work through the answers. So I hope you found that okay. To go through the answers, we've got cyanosis, which is a condition of blueness of the skin due to lack of oxygen. Presbyopia, which is poor vision related to old age or age-related long-sightedness. Infarction is death of tissue due to lack of oxygen or reduced blood supply. Cirrhosis is a condition of scarring of the liver. Thoracotomy is incision into the thorax, so you'd have to just add at the end here in brackets, thorax is the chest, otherwise they won't know that you know what thorax means. Arthrodynia, so arthro meaning joint, dynia meaning pain, so it's pain in a joint. Metastases is secondary deposits from cancerous cells. Necrosis, death of tissue. Erythema, redness of skin or the mucous membranes. Prognosis is the outlook or likely course of a medical condition. Coagulation is the clotting of blood from a liquid to a solid state. Insomnia, the inability to sleep. Thyroid, you could give 2 meanings here. It's a hormone secreting gland in the neck, or it's cartilage within your larynx. So either answer here would be acceptable. Orthoptics is the medical speciality relating to the treatment of eye disorders. And finally, myodysplasia is abnormal formation, which is the dysplasia part, of muscle. Abnormal formation or development of muscle. So add that up and give yourself a score out of 30. So question 4, is worth 10 marks. In this section you're given a medical term and you have to match it to a definition. They actually give you 15 definitions, so bear in mind that 5 of the definitions are there to trick you, and they can be quite crafty by putting definitions that are very similar in meaning. So always read all the options before you settle for one, but really this section should be where you're able to pick up 10 easy marks, as the answers are essentially already given to you. So if you give yourself a minute to work through this question now, you need to put the number that relates to the medical term in the box between column A and B. So for example, number 1 is paraplegia. Find the answer that means paraplegia and write number 1 next to that answer, and we'll see how you got on in a second. Okay, the easiest way to do this is for me to just read the numbers out in order as they should appear on your answer sheet. So to start with, you should have a blank box. So it should be blank 1, blank blank, 9, 4, 10, 3, 6, 7, 8, 2, blank blank, 5. So each correct answer there is worth 1 mark, so give yourself a score out of 10, and we'll move on to the next question. So this is the abbreviations and medical diagnostic tests question. A lot of people don't like the abbreviations. I actually really like them. So have a go at the answers and we'll mark them in a second. Okay, so working from the top here, we've got PCV, packed cell volume, HB, hemoglobin, GTT, glucose tolerance test, U's and E's, urea and electrolytes, mg, which is magnesium. If you put milligram here, then you wouldn't get marks. If you notice, it's a capital M, whereas milligram is with a small m. So the answer is magnesium. Then we have the really long one, MRSA, tricky one to remember, methicillin resistant Staphylococcus aureus. So I'll just spell that last bit. Staphylococcus, STAPH YLOCOCCUS, and then aureus, AUREUS. Very well done if you got that one. IVU, intravenous urogram. O and S, which is organism and sensitivity. Here we're on to the drug abbreviations. So we've got CAPS, capsule, NEB, nebulizer, PC, which is after meals, MCG, microgram, ON, which is every night. When you see O in the drug abbreviations section, so ON, OD, you have to make sure that you put every. This is because the O relates to the Latin for omni, which literally translates to mean every. So AmSpa are quite keen that if you see an O, you have to put every rather than each or repeat. Just make sure O stands for every. So every night for that one. POC means it's for the eyes, and ml is milliliter. So it was 1 point for each of those questions. Add them up and give yourself a score, and then we'll move on to question 6. So question 6, this is a question where you have to give the meaning of various word parts. You'll notice that AmSpa are signalling if something is a prefix or a suffix by where the dash is. So if the dash is after the word, it's a prefix or a root. If the dash is before the word, then it's a root or a suffix. So there's 15 questions here. Work through them and we'll go through the answers. So working through these 15 questions, we've got bronchiolo, which is bronchioles. These are the smaller tubes within your lungs. Steato, meaning fat. Cyano, blue. Endo, which is inside or within. Iatro, meaning doctor or physician. Scolio, sideways. Maxillo, meaning upper jaw. Meno, meaning monthly or menstrual. Coli, meaning bile. Ac, relating to. Blast, which is a new cell. Oid, resembling. Phasia, which is speech, not to be confused with plasia, which is formation. Porosis, meaning porous, brittle or weak. And tome, which is an instrument used for cutting. So 15 marks for that section. Okay, so we're on the last question now. Question 7, which is reading an extract of a letter. So similar to question 1, where you have to define the words in bold. There's 10 questions here, each worth 2 marks. So if you have a go, and we'll work through the answers in a second. So let's go through these answers. Number 1, ischemic. So remember, when words end in ic, we have to say relating to. So relating to lack of blood flow. Angina is pain or discomfort in the chest associated with a heart condition. Osteoarthritis is inflammation of the bones and joints. Lumbar, notice that it ends in AR, so you need to say relating to the lower region of the spine. Diverticulosis is a condition of having a diverticula, which is sacs in the walls of the colon, so you'd have to just define that a little bit more. Anorexia is a condition, so remember, if something ends in IA, it's condition of, so a condition of being extremely underweight. Dysuria is pain on passing urine. MSU is midstream specimen of urine. Nausea is feeling sick. And then FRCS is Fellow of the Royal College of Surgeons. So add those up, give yourself a score out of 20. Then add up the answers for the whole of the paper and give yourself a mark out of 140. So hopefully now you'll have a score for your paper. You need to get 75% or above to pass the paper. So the brackets are, if you scored 105 to 119, that will have given you a pass, which is 75 to 85%. If you scored 120 to 130, then that would give you a merit. That's 86% to 93%, correct? And if you got 94% of your paper correct, which is a score of 131 or above, then you got a distinction, which is really excellent at level 3. So just to pass this paper is brilliant. Remember, it's the first paper. The more papers that you do, the more practice you'll get at seeing the types of questions that come up. A lot of questions are repeated. So the more you do, the more chance you have of seeing something you've practiced previously in one of the past papers coming up in the exam. If you've not passed, then don't worry. Go back to your notes, have a look at your revision guides, do some more self-testing, and then come back and do the paper again. Look at your answers, look at where you went wrong, see if you can learn from those mistakes. That's the whole point in doing this.